Good day, everyone. This report provides information obtained from the book regarding the early childhood developmental stage, presented by the Group 2. Now, let us tackle it one by one.
General introduction. What happens in this stage? Early childhood. Sense of identity is clear. Expansionary will to encompass involvement with others. Acquire new behaviors. Learning through interactions and through mimicking or modeling. Children in the preschool years continue with the development of skills learned in the early years of growth. Their sense of identity becomes clear, and their world expands to encompass involvement with others, external to the family unit. Children in the developmental category acquire new behaviors that give them more independence from their parents and allow them to take care of themselves more autonomously. Learning during the time period occurs through interactions with others and through mimicking or modeling the behavior of playmates and adults.
Let us now move on to the physical, cognitive, and psychosocial development in early childhood. In the physical development, the physical maturation during early childhood is an extension of the child's prior to growth. Fine and gross motor skills become increasingly more refined and coordinated so that children can carry out activities of daily living with greater independence. The gross motor skills that we are talking about here pertain to the skills involving large muscle movements in the legs, arms, and trunk, such as independent sitting, crawling, walking, or running. So in this stage, they can now sit by themselves, they can crawl or even walk and run without the help of their parents or other family members. On the other hand, the fine motor skills involve use of smaller muscles in the hand and wrist, such as grasping, object manipulation, or drawing. They now start using their hands with their own control. Although their efforts are more coordinated, supervision of activities is still required because they lack judgment. They lack judgment in carrying out the skills they have developed. While their actions are now more organized, there is still a need for an oversight of the things or activities they do because they still lack judgment in applying the newly learned skills they have acquired. Cognitive development. It was labeled by Piaget as the pre-operational period. It emphasizes the child's inability to think things through logically without acting out the situation. It is as well a transitional period where a child starts to use symbols such as numbers and letters to represent something. They can now deal with letters and numbers and be able to use them. They also have now the capacity to recall past experiences and anticipate future events. They can classify objects into groups or categories, yet have a vague understanding of their relationships. They are egocentric and essentially unaware of others' thoughts or the existence of others' point of view. They can now play games with numbers and letters. They use this egocentric approach to accommodate the demands of their environment. They believe that everything is significant and related to them and explores the environment. In this stage also, language development is rapid. They can now associate words with objects. Let us now proceed to the two kinds of thinking that was mentioned in this developmental stage. Precausal thinking. The child believes what is seen and heard. It also allows young children to understand that people can make things happen. Piaget coined the term precausal thinking to describe the way in which pre-operational children use their own existing ideas or views, like in egocentrism, to explain cause and effect relationships. In animistic thinking, the children believe that they can influence natural phenomena. They also have the tendency to endow inanimate objects with life and consciousness. Animistic thinking refers to the tendency of children to ascribe life to inanimate objects. It is some kind of illusion that objects have life-like qualities.
During the cognitive development stage, children are motivated by curiosity. They can think intuitively and pose a lot of questions about almost anything. They want to know the reasons, causes, and purposes of why such events happen, but are usually unconcerned of the process. The young child also continues to have a limited sense of time. 15 minutes to a child at this age can feel like an eternity. They do, however, understand the familiarity of the events in their life. As they begin to understand the world around them, their attention span begins to lengthen. The development of sexual identity and curiosity also happens during the preschool stage. They begin to understand their bodies related to the structure. They can name external body parts but cannot fully comprehend their internal organs and the specific functions of their bodies, which can also result their fear of mutilation and pain or bodily injuries. This is due to their lack of understanding and active imagination. Children at this age also believe that illness is self-caused and is a form of punishment for their misbehaviors. This is also called egocentric causation, which is when illness is caused by the child's own transgressions or wrongdoings. The psychosocial development stage is also called as the period of initiative versus guilt by Erikson during 1963. Children take on tasks for the sake of being involved during this stage. They show evidence of expanding imagination and creativity that are mirrored through their impulsive actions and are very curious in everything that they see and do. They also begin to have growing imaginations that lead to many fears, such as separation, disapproval, pain, punishment, and aggression from others. They also begin interacting with playmates rather than just playing alongside one another. They begin to recognize that appropriate social behavior is to wait for others, give others a turn, and recognize the needs of others. Play in a child's mind equates to the work performed by adults. To them, this is equally productive. Play for a child is a means for self-education about the physical and social world. Role-playing is also their typical activity because through this the child attempts to learn responsibilities of the family members and of society.
Next is the teaching strategies. When educating the children, we reassure them and allow them to express their fears. We give simple descriptions and explanations about procedures and interventions, and we include the parents or the child's primary caretakers in the teaching process. Specific teaching strategies. For the long term, first we build trust. Patients are more likely to open up and disclose information if they trust their nurse or healthcare professional, and a better quality of interaction may result in greater patient autonomy and shared decision making. Trust is important in healthcare because health and healthcare in general involve an element of uncertainty and risk for the vulnerable patient who is reliant on the competence and intentions of the healthcare professional. Second, use repetition of information. Children learn through repetition and memorization. They also learn self-discipline. This will encourage them to self-reflect, which will assist them in learning things more completely and quickly. Third, provide safe and secure environment. Nurses are integral to delivering safe, quality care both at the individual and the system level. A child within a safe and caring environment will develop a healthy emotional well-being, in turn, having a positive effect on other areas of their development. Fourth, use positive reinforcement. Positive reinforcement can also be an effective way to encourage and motivate the child to do good and be responsible. Fifth, encourage question to reveal perceptions or feelings. That way, a person can understand a child's thoughts and emotions. They also need an ongoing guidance and support with their emotions to help them understand their own feelings.
Next is the use of short-term teaching strategies. First, we have the use of warm and calm approach. Addressing inappropriate behavior calmly enables you to focus on teaching the child what's problematic about his or her behavior and then following through with the effective consequences. Next, we have the allowing of manipulation of objects and equipments. As the child matures, learning is enhanced through sensory experiences and through movement and manipulation of objects in the environment. Motor activities promote their understanding of the world and an awareness of themselves as well as others' reaction in response to their actions. Next, we have giving care with explanation. Children without adequate care are less likely to attend or do well in school, less able to access health and other basic services, and more likely to engage in antisocial and criminal behaviors. And in many cases, their physical, emotional, and cognitive developments are compromised. Next is to reassure children to not blame themselves. Reassurance can make children feel safe, help them manage their fears, and also help them recover in a healthy way. Explaining procedures simply and briefly. Since children have a short attention span, it is best to explain procedures simply and briefly for them to be able to understand. The use of simple drawings and stories. Children are known to have creative mind, so drawing enables your child's imagination to become more active. Each time they draw, they access their imagination and make physical representation of what's in their mind. Stories can also help the child get to know sounds, languages, and words, and also develop early literacy skills. Use play therapy with dolls and puppets. Puppets offer children an engaging way to interact and explore their knowledge and understanding of the world. Children learn to converse and formulate their thoughts and words to best convey their message. One very effective way to develop children's language skills with puppets is to role play to model oral language. And lastly, stimulating senses, the visual, auditory, tactile, and motor. Children and even adults learn best and retain the most information when they engage their senses. Many of our favorite memories are associated with one or more of our senses. This can be through familiar smells and sounds that may trigger a flashback memory.
The nursing interventions are the actual actions that are performed to help the patient to reach the goals that are set for them. The nurse uses his or her knowledge, experiences, and critical thinking skills to decide which interventions will help the patient the most. The nursing interventions for early childhood are the following. First, welcome active involvement. Second, forge alliances. Third, encourage physical closeness. Fourth, provide detailed information. Fifth, answers questions and concerns. And lastly, ask for information on child's strengths, limitations, likes, and dislikes. These nursing interventions may serve its purposes with the guide of behavioral approach, which may directly help the patient to achieve maximal functional levels.
Thank you so much for listening.